I will say perimenopause is definitely the most challenging time. Once women go through menopause and the hormone levels are low and not fluctuating anymore, there are symptoms along with that we can go over, but it is so much better to handle.
Wow, good. There's a light on the other side.
There's definitely, absolutely, yes.
I'm Mira Kaddoura, and this is Into Healing, Austin Edition. On this episode of Into Healing, we talk about perimenopause, a season that can begin as early as 35, often quietly and alone. Sophie Hunt, a women's health clinician, helps us break the silence and see this time not as a loss, but as an opportunity for self-advocacy and a deeper self-knowing. If you support our mission of giving everyone a way into healing, please consider becoming a paying member through our Patreon. Your generosity will help bring more meaningful conversations to the world. Hi, Sophie.
Hi.
I'm excited to have you on today.
Oh, thank you. I'm happy to be here.
I feel like there is so much, some shame, some misunderstanding, some just confusion around this time of life that we call perimenopause for women and what actually is happening, or as I'd like to say, what the F is happening right now.
Right.
And I recently took this little class, and I was shocked to know that some of these symptoms start as early as 35. I was like, what? Why are we not told? Why are all these things kind of kept quiet? Why is there so much shame around it? Why is it just taboo to talk about these things? So I'm just really excited for you to be here and to just demystify this phase of life.
Sure.
And really talk about how we kind of step into our power through this phase of life as well as women.
Yeah.
So maybe let's start at the beginning. What prompted you to go on this path and want to be on this journey to get into women's health and, hormones and perimenopause and all of that?
Right. So I'm a physician assistant by training, and I've been a primary care provider and providing a lot of women's health across a woman's lifespan over the last 24 years. So I did work in prenatal clinics and did a lot of regular birth control and woman exams and things throughout my time as a primary care provider. And when I started going through perimenopause myself about 10 years ago is when I started wanting to learn more. I didn't really have any information in my training. I came out of PA school in 2001, just before the Women's Health Initiative study took everybody off hormones in 2002. And all I'd known about was Premarin and Prempro. Those were the mostly prescribed hormones. And at that time, anyone who went through menopause ended up on hormone therapy. That was just a natural thing you did. You go through menopause, then you get hormones. And then the study, which was misreported, came out, and all of a sudden we thought, oh, we're doing all this harm. We're causing heart attacks and strokes and breast cancer, and we have to take everyone off hormone therapy. And it stayed kind of quiet like that for many, many years. And
why is it? Do we just not study? Do we not study women?
I think
half the population,
I
or
know,
close
I
to
think that is a big problem, and I think we still deal with sexism in medicine even now in this day and age. Certainly, that many years ago, and it has to just start changing. The other thing we experience is ageism in medicine as well, and I had that experience with my mom a couple of years ago. So, for me, it was just personally, I was going through some things and wanted to find out more information, so I started attending some conferences. And honestly, it was conferences with naturopathic doctors. That's who I found who were doing hormone things. And so started doing some of those courses and learning a little bit about their approach. And then having to go to my provider and say, I think I need some progesterone at this stage. These are the symptoms I'm experiencing. And I found that to be incredibly valuable for myself. And so I just, because I was going through it and I was interested in it, it naturally became something I wanted to provide to other women. And slowly, as I was entering into late perimenopause and menopause, I wanted to shift what I was doing with my own career and practice, and wanted to focus only on this so that I could educate and empower as many women as I could. This is before this whole menopause movement came along, which I'm so grateful for. The timing is beautiful, but that was really what made me decide to go into this.
So in this little course that I took, they talked about up to 100 symptoms. And I was like, I thought it was like 2, 3, 4, 5. But when I heard 100, I was like, oh my goodness, like we dismiss so many things, that whether it's a migraine or whether it's this or that, or, like not sleeping at night or all these things, we just dismiss them as like, oh, I just had a bad night of sleep, or, oh, I just haven't had a migraine. Maybe I'm stressed. And we don't track patterns. We don't kind of keep track of like what's happening. And when I took this little course, I was like, I don't think there's any awareness about how many symptoms could actually be this phase of life that you're in.
Right.
So maybe if you can you'll speak in a second about what the F's going on.
Yes.
But maybe you can speak to the symptoms, the like large, vast amount of symptoms. And obviously I'm not expecting all 100,
Sure.
but just all the different symptoms that could be part of this phase.
Yes.
That maybe we dismiss or just discount as something else.
And something that comes to mind in your posing the question is, we don't really talk about puberty and periods and girls and that transition to begin with.
Yeah.
And so if we're not doing that at that stage,
we're not going to do it
if
at
it is taboo to talk about sexual education in schools, and for girls and boys to talk about their bodies and puberty and what hormones are coming on with testosterone and estrogen and progesterone, we're not going to be talking about it because we're not conditioned to. It feels, we're not meant to be talking about this, which is completely wrong, because teenagers don't understand their bodies, and it's very confusing, and they go through a very difficult time. As girls start to get their periods, their ovulation is erratic and their hormones are onboarding, and it's just all over the place, and it's a really tough time. What women are going through in perimenopause is coined the second puberty. So similar things where ovulation is becoming erratic, hormones are fluctuating all over the place, but coming downstream, and that can cause an array of symptoms. And it is a very individual experience. So we have estrogen and progesterone and testosterone receptors in our brains, in our skin, in our eyes, in our joints, all over our bodies, in our GI tract. And when our hormone levels fluctuate and become erratic, that can affect some of the symptoms women are experiencing. The more common symptoms we see in perimenopause is mood changes, so feeling less resilient to stress, feeling more overwhelmed more easily. So I used to be able to handle these things at work, and now I feel like I can't handle anything. Some women experience new onset of ADD symptoms, like I was really good at focusing and getting my things done, and I feel so scatterbrained. Insomnia is a very common, midnight waking in the middle of the night is very common as our hormone levels fluctuate. And more cyclic symptoms would be my periods have changed. Now, you can have perimenopause symptoms before changes in your cycles, which is really tricky because we don't have a test to say, oh, you're in perimenopause, this blood test shows me this. And you can have symptoms before you have irregular cycles, but most of us providers would say, well, your cycles are every month, so everything's fine.
Normal.
Yeah. And so we don't have enough information or testing modalities. So I think discussing, talking, reporting, journaling and writing down, this is what I've been experiencing. I saw a 37-year-old today, and she's still having her periods, but 2 years ago is when her symptoms started, and it was all of a sudden I had this anxiety. I was feeling really great, and then it was anxiety that I'd never felt before. And from there, things started to show up. So it is tricky. Yeah.
Yeah, like how do we know it's this, not something else? And that's like so hard to figure out, especially if we don't have any guides or anybody kind of helping us through this time.
And that's important to know that, yes, if you're not sleeping at night, your brain is not going to function that next day. If you're getting 5 hours of sleep, interrupted sleep, almost like when you're having a baby or when you're, doing night shift work or whatever it may be, the brain's not going to be on board. You're going to feel less resilient to stress. And so finding a clinician who can tease those things out what else has changed? What else is different? Is there something that might be contributing to this type of thing? So, because it is hard, it's very gray.
Yeah,
to know.
it's hard to figure out. Like I know personally, I just thought, oh, my sleep has been disrupted because of having kids, and it's just never going to go back to what it was.
Right.
And it's just normal that now I wake up in the middle of the night and it's 1 a.m. and I can't fall back asleep.
Right.
And that's just how it is. So I connected it more to like the having of the children,
Right.
not the like maybe going into this different phase. It never even occurred to me,
Yes.
It's
That's
like,
very
oh,
interesting.
that my body's moving into this other phase,
Absolutely.
And that could be really confusing, I think, for a lot of people to know what's what.
Yes.
So maybe, is there a few more symptoms you want to just kind of share that people should even, like, I know for me it was like migraines. I used to have migraines in my 20s, and I did a lot of acupuncture, and they went away. And then just migraines in the last few years have been kind of coming back. And I'm like, where did this come from,
Yep. That's very common for migraines to start worsening as perimenopause begins. And then that is the fluctuation of the hormone. And it's usually the decrease of estradiol that we see right around ovulation, and then again a decrease of estradiol that we see before we start a period. And because it can be more pronounced during perimenopause, so instead of having a nice curve, perimenopause you tend to have bigger swings, that can be harder to handle. So we do start seeing worsening menstrual migraines. And it's really important to track migraines and cycles, because are they hormonal migraines or are they not hormonal migraines? Are there other triggers? Because as you know, if you've had migraines, there are other triggers that can occur. So tracking is really important when you get to that point. Sometimes hormone therapy in those areas can be helpful in reducing the amount of migraines. Other symptoms can be hot flashes or night sweats. Not everyone gets hot flashes or night sweats. Not all hot flashes are sweat-inducing. Some people can have dry hot flashes, like Arizona heat. You just feel like you're cooking from the inside. So those are some symptoms that we see. And then as far as for the GI tract, we start noticing maybe some more bloating, constipation changes in our microbiome because of our loss of hormones, causes changes in the way that we process food and the way that we eliminate food. When we get later into perimenopause and are really becoming deficient in estrogen, because there are two phases of perimenopause. There's the early perimenopause phase and then the late perimenopause phase. And the late perimenopause phase is when you start missing periods for 2 to 3 months or more, and your estrogen levels are really declining. And that's when you can start experiencing also more vaginal symptoms, so dryness, discomfort with intercourse, recurrent urinary tract infections, or feeling that burning, like you have to go to the restroom. So those are the vaginal symptoms you can experience. And other symptoms can include joint pain, where we have estrogen receptors in our joints, and some women are very sensitive to that and will also start having some pain in their arms and in their hands and wrists. And it is important to rule out autoimmune causes of joint pain when things like that start to present, but that is a common presenting symptom as well.
So what is happening in this time? Like just biologically, emotionally, all of it? Like what is happening with our bodies?
Right. So we are born with a certain number of follicles, and we as we ovulate, we go through many, many follicles. And then we get to a certain age where that number of follicles is very low, and this is where our hormones are affected. And so in perimenopause, the first thing to go is progesterone, usually. And progesterone is a hormone that we make after ovulation. So if you think of your menstrual cycle as the day one of your cycle is day one of bleeding. As you start, your period ends, you start to increase the estradiol level, and that climbs. Mid-cycle is when you would release a follicle and ovulate. And that's usually 14 days after your first day of your period if you have a 28-day cycle. When you release that follicle, that corpus luteum in the ovary is what makes progesterone. So we only make progesterone if we ovulate. We have no progesterone the first half of the cycle in our follicular phase. We have progesterone in the luteal phase. And what happens in perimenopause is sometimes we'll have a cycle, but we won't ovulate that cycle, so we're missing our progesterone. So we start seeing a deficiency or a lowering of progesterone, which can cause problems with increasing your cycle length or shortening during your luteal phase. So some women will have longer cycles. Now I go to 35 days instead of 28. Some women will go to 25 or 24 days and have a shorter luteal phase. Everyone's a little different. And when you don't have that progesterone on board, that can lead to higher levels of estrogen that is not balanced out by the progesterone and can increase the risk of bleeding, fibroids, flaring of endometriosis. And as that process continues, you'll have cycles that are normal with ovulation and cycles that are anovulatory, and that can cause that fluctuating hormone level.
Sometimes you have some of these symptoms and you don't know if it's, like I didn't know what it was. I didn't know what was going on, like migraine or waking up in the middle of the night. I just thought, oh, my sleep's disturbed because I had these kids and it hasn't really recovered. And now I'm awake at 1 a.m. and I can't fall back asleep. It never occurs to me that I might be going into a different phase of life. So maybe if you can even share how your perimenopause was and what you started picking up on and kind of seeing and how your body changed in this time.
Sure. Yeah. So for me, in my mid-40s, I had children a little bit later. And, certainly women who have children, it gets trickier because, like you said, well, I'm not sleeping because I've been waking up on hypervigilant awakes for 7 or 8 years now. And so that's what my body's doing. For me, it was a worsening of PMS symptoms. And that is a very common symptom in perimenopausal women who have had PMS or new onset PMS. And premenstrual syndrome is irritability, mood changes, not feeling quite right, fatigue that can occur for women 1 to 2 weeks before their period starts. And then when the period starts, everything is much better. So it's really important to know about that timing. It's not all month long. It's specific to after ovulation and before and ends when your period starts, usually within a couple of days. And so firstly, it was that irritability. Of course, my kids were, 6 and 4 at that time. And so that's a lot too, 3 and 5, 6 and 4. You're working, you're managing a household, you've got kids that you're dealing with. And so you just figure, I'm just in the thick of it. I've got a lot going on. But really it was the hormonal fluctuations. And it took a really long time for me to recognize that there's something different. And that's when I decided to ask for progesterone from my provider. And it was really, really helpful to help stabilize those symptoms.
So how did you feel after being on progesterone? Like, did it take away all the irritability and everything else? Like,
for me, it did. I will say it was several years between starting to feel this way. So maybe I was 43 when I was like, ooh, this is not good. And I was 48 when I was finally like, I need something. So even as a medical provider, it was very delayed. And even though I was seeing my healthcare provider every year for my well woman exams, it wasn't something that we really talked about.
Why is that? And
I don't
you're
know.
in the field.
Right.
Wow.
Well, there's a bit of shame with feeling irritable or ragey or PMS. And so perhaps, and people are busy and you go into your visit and you've got so many things to cover that sometimes, you don't have that time or space. And so trying to do things on my own, whether it was exercise and nutrition and sleep was never an issue for me until I went through menopause. That was a complete different ballgame. So that wasn't a problem for me, but trying to figure things out, trying supplements and all sorts of things, and then finally having to say, okay, this is something I need to try. And it was after a conference I went to, and I was like, oh, there's something else that we could do here. And it was really different, like amazing, but it's not like that for everyone. I will say perimenopause is definitely the most challenging time. Once women go through menopause and the hormone levels are low and not fluctuating anymore, there are symptoms along with that we can go over, but it is so much better to handle, not these levels that are, so it gets so much better.
Wow.
Yeah.
Wow, good. There's a light on the other side.
There's definitely, absolutely, yes.
So what are different ways we can support and help in healing, this time, which I think a lot of women just totally don't feel themselves. And, it's so weird because it's like as women, we go through so many changes, right? Like, it's like just when you have a handle on things, things change, right? Like, you have your period, you go through puberty.
Yeah.
And then you go, if you have kids, you go through that. So there's like all these changes that are constantly happening. And just when you feel, at least I'm talking personally, you get a handle on things, you're like, I got this. Life's like, okay, here's
Now you
something
don't.
else.
Right.
And it's like, I feel that can make you feel just, I mean, it's like the rug's being pulled under you. Like somebody's playing a little bit of a sick joke on you when just so much change happens, right? And I mean, we're amazing beings that we adapt, right? And we're resilient and we move through things, but maybe speak to just the mental emotional part, not just the biological part that's happening too with women.
Yeah. I think it's really important that women find a community of other women that are at similar life phases so that you don't feel so alone and so isolated. And in this day and age, it seems like to be difficult to do, but just reaching out to women in your neighborhood or women in your schools or wherever it may be. The other thing that is really important, I think, to help change kind of what's happening around women in this time is for us to stop doubting ourselves and just try and listen to our whispers and our intuition, because a lot of times we know what's wrong, but we've been socialized. To not listen to that. And we've been a little gaslighted here and there with different things and complaints, right?
So, we can get on a whole...
So I do think that it is important for women to be able to find a way to trust themselves and to sit quietly and listen to themselves. And if it feels like there's something not right, like our gut and our intuition is pretty right on. We've just not learned to open up and listen to that.
And a lot of things that we do bring up are dismissed.
Oh,
and,
still.
That's the gaslighting that you just brought up.
Yes.
Like I think, oh, you're fine, nothing's up. I mean, I do labs every year, and it's most of the time it's like you're fine.
Yes.
Everything's fine.
Numbers are fine.
Numbers are fine, or take a little vitamin D, or take a little iron, and all's good, all is well. And,
right.
And I just think that there's just not enough. There's not enough research. There's not enough knowledge, around women and our needs. I mean, that's really the bottom line, right? So how can we share that with each other and get this...
And just be more assertive. I see my labs are fine, but I am not fine. Like just having to be more assertive and also finding that person. I will share a story, whether this is... it's not menopause story, but my mother at 86, just 3 years ago, went through a really bad medical problem, and it was fairly quick in onset. And she started having really severe neurological symptoms and was 90 days in and out of the hospital. And poor thing was just in a bad shape. She couldn't use her bladder, stopped working, her bowels stopped working, she had intractable vomiting, she couldn't walk or move very well anymore. And the hospitalists would come in, oh, labs look great, everything looks good. And then the neurologist would come in and be like, well, everything looks okay. And it was like, the neurology exam's the same as it was yesterday. And it's like, you could watch her and see how badly she was doing, and even at one point it was funny because she hadn't...
Funny, not so funny.
No, it was traumatic. Yeah. She had not had a bowel movement in like 21 days. She had an ileus. And so her colon wasn't working at all. And the gastro was like, oh, she needs Go Lightly. So they brought in this like many liters of liquid to drink to have her clear out her bowels. But she'd had intractable vomiting for 3 weeks, so hadn't been able to eat or drink. But they didn't even think like, oh, she can't swallow or drink this much fluid. It just was kind of funny. I thought, you're not going to be able to put this down, this poor woman. And so it took 6 months. She'd almost died and had become almost a quadriplegic. And the neurologist said she needs to see a psychiatrist. And I was like, I don't think this is psychiatric. She was fine 6 months ago. And she finally was diagnosed with a lot of assertiveness and finding people. And it was really frustrating as a medical provider here in town. But she was diagnosed with a rare neurological disorder and is now, recovered mostly with her medication. And but she was, not really looked at and not mistreated, just like, well, everything looks okay and, things are fine. And so I think it's important for women to just know that if you're really feeling something is not right, we just have to be a little bit louder, because we are not being taken care of in the same way.
Yeah, why is it that there's an invisibility that happens as women age? Why is that?
I think it's not just as we age. I think it's lifelong. I mean, if you think about our careers, and we're still not making the same amount for the same work as men do, and so it's not necessarily as we age, but I do agree that as we age, we're not considered valuable, which I think is so wrong, because
so
we are
wild.
more and more valuable. We've had so many years of experience, whether it's taking care of family members or having children or focusing on a career and really doing so many things with our lives while we're going out through monthly periods and cycles. Like, this is a
All of
big
that,
deal.
yeah.
Having a monthly period is a big deal.
Totally.
And so we are in a different mind space by the time we get to menopause. And it's better too. So menopause is a time when women start going, wait a minute, this is finite. Like, what do I want from me here for this rest of my time on this earth? And sometimes that's with age too, right? Usually when you get into your 50s, you're like, yikes, like, this is going to end in time. What do I want to
What
change?
am I doing?
I'm not going to continue this. Or kids are older and out of the house, or careers are at the height, but you're not feeling a lot of gratification, or you're working way too much. And I think it's really a beautiful time for women to be able to go, this isn't working for me, or this is working for me, or this relationship is not great for me, or this friendship doesn't bring me joy, and start really figuring out what you want. Women who go through menopause also tend to be more self-accepting for the first time in their lives, which is beautiful. And so my reasoning to want to go into this is to let women know, no, menopause is a really wonderful time. And perimenopause is a very challenging time, and there are things we can do to help support those symptoms in those times. It's still hard even with that, but when you go through menopause, it's just different. It really is.
How can partners support us through this phase? Because I feel we already know so little, and then the partners probably know even less. So is there any ways that they can support us through this phase that is quite profound?
It is a big phase, and I really think it lands on us providing resources for our partners, because partners can be in different stages of lives, or men partners will not really understand what's happening. And so if you find a resource that resonates with you, share it with your partner. Explain to them what's going on. If Oprah had a show the other day, and I had my sons and my husband sit down and watch it with me, just so that they could, so doing things like that, whether it's watching a special or listening to a podcast, but something that feels good that you've read or listened to, then sharing that with a partner or having a conversation. Especially men may not be as encouraged to want to read a whole book on menopause because they're not going through it. So just, putting
Cliff notes.
Cliff notes on the parts that might be, helping them understand what your experience is important.
Seems like I've heard about the kind of after, when you go through menopause, and that kind of post-perimenopause phase as very empowering and very where you kind of really step into your power as a woman. Maybe you want to speak on that a little bit.
Yes. Personally speaking, just to share my experience again, I worked in the primary care clinic for 10 years, love my patients, love the people I worked with, and never really wanted to go off on my own and start a clinic on my own. I actually chose to go to PA school instead of medical school because I did not ever want to have my own private practice. Years ago, I wanted to be able to be home part-time with my kids. And so I think menopause is the reason that I was thinking, gosh, what I'm doing right now in primary care and having lack of control over my schedule and not having enough time with patients and running behind because I'm spending the time with patients isn't really working so well for me. It's not enjoying it. It's very stressful. And wanting to take care of women in a different way and allow women to have time at their visit and be able to look at the whole woman is what I wanted to see. And when you're in the model I was in, I didn't really have any control over my schedule or the way that the clinics were run. And it wasn't bad. It just wasn't working for me anymore. And really, I think it was menopause that allowed me to go, I'm going to have to change something. And it was very difficult to leave income and stability to do something that didn't have an income and not know if it was going to work. And it did take 2 years of intensive work and listening to my intuition. But I wouldn't have done this in my 40s, and certainly not in my 30s or my 20s. I think it was menopause that allowed me to do a 180, where now I'm a small business owner, which I never, ever wanted to do in my life.
Yeah. Amazing.
Yeah.
Amazing. When you're speaking, it reminded me of the stat I read once where women get, I think it was either somewhere between 7 and 11 minutes annually with their healthcare provider, and how little that is to even go through anything that's going on per year, right?
Right.
And I even remember my first meeting with you, I think we went at least an hour or something, and how much you can talk about in that hour, right? Versus 7 or 9 or 11 minutes.
Or really get an idea of where your symptoms are coming from.
Yeah.
And the thing is, because it
what's
is
happening.
multifactorial. It is not just about hormones. It's how that affects sleep and nutrition and physical activity. When you're tired, you're not going to make good food choices, and you're not going to want to exercise. And so
it's like really a snowball.
Distilling that, because if I just give you a prescription for hormones and that's it, it's probably not going to fix everything. Now, if it's just that you're not sleeping because you're having hot flashes, yes, the hormones are going to fix that usually, and that's pretty easy peasy. Yeah.
So tell me a bit about what women in this perimenopause phase are supposed to ask for, or, what are things that could help them? I feel a lot of us don't even know what to ask for, or, you've talked about hormone support, bioidenticals. Maybe walk us through kind of all of that, the different options. And, sometimes people do get on hormones, sometimes they don't.
That's
just
right.
All of it. What are our choices? That's my question.
That's a good question. It's a big question. So perimenopause is a little bit different than menopause in the sense that you are still ovulating occasionally. So it's
or
important.
Regularly. I'm still
regularly,
completely
and
regular.
not you specifically, but yes. And so a birth control method is something that needs to be on board, whether that's if you're having, heterosexual sex. So if condoms are a birth control method, vasectomy is a great birth control method. Birth control pills, IUDs, those types of things, rings. So a birth control method is important when you are in perimenopause. And so we have to take that into consideration.
Because you see a lot of twins, apparently, right?
Well, twins, so you get an increase in twins after the age of 45 because of the erratic. It doesn't happen often, but that's when you're going to see twins is, with an older pregnancy. And we don't want that to happen if you're not intending to have any more children. So that can affect things, because if you're perimenopausal and you need a birth control method, and you're, you don't have the option of vasectomy or condoms, then we have to talk about a hormonal birth control method. The natural family planning method is a little difficult in perimenopause. If your ovulation is erratic, if your cycles are way off track, it's going to be difficult for you to know when to ovulate. So though that's a good birth control method, when things are regular and you have cyclical ovulation, it's a little trickier. And so that affects the treatment. Because if I put someone on menopause hormone therapy, it won't provide birth control. And let me explain a little bit about the difference between birth control pills and menopause hormone therapy. So birth control pills are high enough dosage to inhibit release of hormones from the pituitary, telling the ovaries, all right, it's time to make hormones and ovulate and do all that thing. So it suppresses ovarian function, and then you don't ovulate, and that's how you prevent pregnancies. And so when we give birth control pills, they're high doses, they suppress your normal hormones, and they don't necessarily act the same way as our normal hormones. So some people do fine on the birth control pill because you don't have any fluctuation. So your ovaries aren't doing anything, and that pill is usually the same dose all the time. And some women feel really good not having any fluctuation in their hormones. Some women don't tolerate not having their natural progesterone on board, or having a synthetic progestin can have some mood changes as well. So that's very individual. And so treatment of perimenopause can include birth control pills, depending on the woman, if we're trying to level out hormone fluctuations. Sometimes in perimenopause, the addition of micronized progesterone, which is a pill that you take orally at bedtime. It is very sedating. It can help with sleep. It can help with mood, is something that we start with. And if you're having regular monthly periods, then we tend to mimic where that progesterone would be normally. So that's where you cycle progesterone, those last 2 weeks of your cycle every month. If the estrogen levels are low in perimenopause, and again, timed at the right time of your cycle, or if we see that FSH level rise, then sometimes adding a low-dose estradiol patch or gel can help also those dips when women have those menstrual migraines. We haven't studied hormone therapy in perimenopause, so we don't have these long-standing of this is safe or this is what will happen, and so everyone is...
It's a little bit the Wild West.
It's a little bit of that, yeah.
So just based on your personal experience working with your patients.
And how the patient responds to the treatment. But yes, so those are the options in perimenopause. If we have very heavy bleeding from fibroids, then sometimes progestin IUDs are really helpful with that. Heavy bleeding meaning you're iron deficient, you're having anemia, that needs to be treated. And sometimes IUDs are they don't suppress the ovarian function, so you can still make your own hormones, but they target that endometrium, so that can be very helpful, and it's a birth control method as well. And so there's lots of ways to layer different things on.
Well, how do we support like women's mental, emotional, outside of just like hormones or bioidenticals? How do we support women
in perimenopause specifically, or in any stage of life?
I mean, specifically perimenopause, but you can also speak to other.
So it depends on the symptom, whether it's a depression type mood change or an anxiety or panicky mood change, or rage or irritability. And so it depends on where people are in their cycles as well. And so if you're doing hormones that aren't helping that, or if it's a non-hormonal approach, then certainly I recommend therapy with a counselor. So cognitive behavior therapy or talk therapy can be very beneficial. Supporting things like sleep so that we are functioning at our best. And then exercise. We know that regular exercise increases serotonin levels as much as antidepressants. There was a recent study on that. I will say our brains have not evolved to our current lifestyles. Our brains are closed in this little cave, and we are meant to be running from our stress and chasing our food and climbing to shelter and moving our bodies in challenging ways. And when our exertion stops, it's a sign to our brain that we're safe and we're fed and we're sheltered. And so if someone is dealing with a lot of mental health challenges and they're a little stuck and they haven't been moving their bodies, because movement is really important.
Or that's like working from home, just sitting on a chair all day.
Yes. So we're not meant to do that. All of our big muscles are from the waist down because we're supposed to walk everywhere we go. Where we live here in Austin, we are in our cars. Other cities where you're having to go take the subway and then go to the grocery store, and then you've got your grocery bags and you're walking up to your apartment, taking the stairs, that movement all counts. And so I just really encourage women to really try and move. It doesn't have to be once a day in a large chunk of time. We know that small amounts throughout the day definitely add up and can be more beneficial.
How about nutrition?
Yeah, nutrition is important in all stages of life. And having a wide array of vegetables and some fruit and some healthy lean proteins are important. The vegetables are important for a couple of different things. Fiber, we talk a lot about fiber in perimenopause and menopause because our gut microbiome changes with hormone level changes. The gut microbiome is the bacteria that lives in our intestine that pretty much dictates our health, really is important. Our microbiome in our skin and our vagina and our gut are very important parts of how healthy we are. And so feeding the gut microbiome with fiber is what we need to do. And there are prebiotic foods, so fibers that we don't digest that make it to our colon so that our bacteria can feed off, things like onions and artichoke hearts, garlics and leeks. Those are prebiotic foods. And then probiotic foods are fermented foods, which in our society we don't really ferment anymore. So we don't have a lot of fermented food in our diet, but things like kimchi and sauerkraut and kombucha, yogurt, things like that. So having a combination of probiotic and prebiotic nutrients in our diet is really important.
And supporting in all these different ways, whether it's through movement or through nutrition, through sleep, that seems like so foundational, through hormone replacement. What is that setting us up for? Because I know that there's a lot of things that end up kind of health issues that start coming up if we don't support our bodies in these really crucial ways.
Yeah, so when we start losing our estrogen, our LDL cholesterol starts to rise automatically. We can become insulin resistant, and that's just from the loss of estrogen. And we haven't talked too much about menopause, but becoming menopausal puts you at risk of different things. So once we become postmenopausal, that is a risk factor for developing heart disease, laying plaque in your coronary arteries. Estradiol is a very potent anti-inflammatory in our bodies. It helps us keep our arteries vasodilated, so nice and open, and we have estradiol receptors lining in the arteries, and when our estradiol binds to those receptors, it's a potent anti-inflammatory.
That's why our hormones are so supportive
They're
when
so
we
important.
have them.
Yeah. 2/3 of all my Alzheimer's patients are women, and that is likely because of how quickly we lose our hormones. So men tend to lose testosterone slowly over their lifespan, whereas women lose their hormones pretty quickly at that menopause transition, and then we have the next 20, 30, 40 years without our hormones. So we don't know, and I can't recommend that hormone therapy is going to reduce someone's
likelihood of getting
risk of getting Alzheimer's disease. We don't have that data yet. We do know women who go through premature ovarian insufficiency or premature menopause, they are at higher risk of Alzheimer's disease and certainly heart attacks because of their lack of hormone. So we must put them on hormone therapy until at least the age of 52. But in menopausal hormone therapy, we don't have data to show that the estrogen that I give you is going to have the same impact on your brain as the estrogen that you make endogenously.
So after you get the support, say, from bioidentical hormones during perimenopause, do you stop those in menopause, or is there something else that kind of hormone-wise?
I think the hormones are probably more important in menopause than perimenopause. Yeah, so perimenopause, they're there to kind of support the fluctuation and maybe the symptoms. Well, let's talk about the benefits of hormone therapy and a little bit about bioidentical versus not bioidentical, because it can be very confusing. And so we have 3 basic hormones that we can do for hormone therapy, and estradiol, progesterone, and testosterone are the 3. A bioidentical hormone is a hormone that's been synthesized in a lab to click into your receptor identically like your hormone does. So it looks and acts just like your hormone. A non-bioidentical hormone are things like birth control pills or Premarin or progestins. They're formulated to act similarly, but they're not identical. And that doesn't make them better or worse. It's just a different approach. Compounded hormone therapy gets really confusing because people equate bioidentical with compounded. You can get prescription bioidentical hormones through your regular pharmacy with a regular insurance plan, like the patches and the gels and the micronized progesterone. Those are all bioidentical. Compounded hormones are made differently by compounding pharmacists in a compounding lab, and they use bioidentical bases, the same estradiol or micronized progesterone that the pharmaceutical company used, but they put them in different mediums. So if someone is allergic to peanuts, they can't take micronized progesterone because it's made in a peanut oil base. So we have it compounded into a different base at a compounding pharmacy. Testosterone is a hormone that women make that is important for our brains. It's important for our muscles, and it's indicated for libido here in the States, but it's important for other things as well. And we don't have an FDA-regulated testosterone prescription for women, so that is usually compounded for women to be able to use.
And when do you bring that into the mix?
That's when testosterone is deficient, and that's through a blood test. And you can see that in perimenopause. You can sometimes see that through menopause. Oftentimes, so we do make our testosterone through our ovaries and our adrenal glands. So menopausal women, oftentimes in their 60s, their testosterone comes back up just because of what's made through the adrenal glands.
Oh,
So
interesting.
some women have low testosterone problems, and some women testosterone is normal throughout the whole time.
Really?
It's very individual, and that's definitely a hormone that I check.
Wow.
Yeah.
So some women don't lose testosterone. Wow, that's so interesting. Huh.
Yeah.
Feels so random. Is there some rhyme or reason
I
for
haven't
it?
found the rhyme or reason. For that, obviously, if you're on a birth control pill, that will affect testosterone levels and things like that. But women who aren't doing anything like that, it's tricky to know what's causing that lack of testosterone.
That's so interesting because you do hear like women who their libido is totally fine and others that completely lose any interest,
Yes.
you know? So it's kind of interesting how that's different for different people.
It is, and it's not always due to the testosterone.
Oh,
So
interesting.
libido is multifactorial. It's a brain function, and so sometimes if the testosterone is low and we replace that or we supplement that and the libido comes back, great. But I have sometimes patients who come in on testosterone pellets. Their testosterone is very high, and they're like, but I have no libido, and it's very tricky. So this
Is it mental, emotional?
Part of that is. Part of it is interrelational. How is the relationship with your partner? And so the other thing is if you're having pain with intercourse, you're not going to really want to have intercourse. And so addressing those factors are really important.
Yeah.
And estradiol is important in maintaining our bone health, so reducing the risk of osteoporosis and reducing the risk of hip fractures. As many women die of hip fractures as breast cancer every year. So it's a real problem. And we do lose the majority of our bone during the 4-year transition of menopause, 2 years before menopause transition to 2 years after. Estradiol is shown to reduce risk of colon cancer by 32%. Like it has a really big impact on our colon as well. And then the other benefits of cardiovascular health, we don't use it to prevent heart attacks, but it is there to help keep our arteries open and the inflammation down. Osteoarthritis, so of the knee and the hip, where patients need to have hip and knee replacements, we are at higher risk compared to men once we enter menopause. Before menopause, we are at lower risk. So our hormones are really important in that regard. So I would say menopausal hormone therapy is really important once you lose all of your hormones, more so than during perimenopause.
Oh, wow. And how long? You just keep it going forever?
That's a great question. And I don't know the answer to that.
Until you're in your 90s
yes, I don't
or
have
until
an
you
answer.
die?
So as long as you get a benefit or don't have a contraindication for hormone therapy. And so the Women's Health Initiative study, when we took everyone off hormones and women were struggling with moderate to severe hot flashes.
And this happened when?
In 2002. So it was pretty drastic and pretty
because
difficult.
Something was said about them not being supportive?
So the results came out that the use of hormone therapy increased breast cancer by 26% in women, and women who took hormone therapy had higher incidence of heart attacks and strokes. So we were causing harm in women.
And this was like research that was done?
Yes, this was a study, but it was misreported. And there's a lot of information and books written about this. I won't go into too deep of a detail, but 20 years out now, we know this is not the case, and this was not reported properly.
Wow.
And so women who are on estrogen-only therapy in the Women's Health Initiative study actually had a lower incidence of breast cancer. And the women in the study who were on estrogen and a progestin, not progesterone, it's a little bit different, had a slightly increased risk of breast cancer, like 0.1% increased risk. So you have a higher incidence of breast cancer with use of alcohol or with a high weight, so obesity, than you do with any hormone therapy. So that was kind of the big scare. And so we did put a limit on, well, if you're suffering with debilitating hot flashes, your hot flashes had to be debilitating. That's pretty bad. Then we'll give you hormone therapy for up to 5 years. But then at 5 years, we have to stop. And some women's hot flashes last 7 to 10 years. I have patients in their 70s who come to me saying, I'm still having hot flashes and now I want to start hormone therapy. So it sometimes is lifelong for some women. So So now we don't have a fast stop. It's not at 5 years you have to stop. It's if you're getting a benefit, which the bone benefit is pretty much for everyone. So if there's a benefit and you're feeling good, there's no indication to stop. I may have a different recommendation 10 years from now. I don't have a way to know. But I have lots of patients who are in their 60s and 70s, it's even in their 80s, who are continuing their hormone therapy that they started, a long time ago, who didn't go off things, who went to find something else. And hot flashes, we mentioned a little bit, are not a benign thing. So hot flashes are an event that happen in your hypothalamus in your brain from the lack of estrogen in those receptors or progesterone, and it causes inflammation. So we know through the study that women who have moderate to severe hot flashes that go untreated have a higher incidence of heart attacks, not strokes, but heart attacks, osteoporosis, and dementia.
Wow.
So we want to treat hot flashes. And that's a really easy one. If someone comes in with hot flashes, then we want to make sure that those get treated.
Obviously, there's some women that are in their 80s and 90s that have never taken hormones and seem to be just fine.
Right.
So how do we know if something's right for us or not? And
That's
how do we
right.
make those decisions?
Yeah, that's a hard question I don't have an answer for. So which women will age into their 90s without any problems with their bones or heart or brains off hormone therapy? Because there are many women out there doing that. And which women need that support? So I think it's unsure of how to answer that. If you are a young woman going through menopause in your 50s, that's young, and you already have bone loss, then that is indicative of we should consider supporting that with estrogen therapy so we maintain as much bone as we can and then work on building it in different ways. So it's a very individualized approach. It's very important to know that not everybody needs to be on hormone therapy. Hopefully one day we'll be able to say, yeah, this person will age fine without having to be, in any specialized care without hormone therapy, and this person won't. I don't have that answer. Yeah. I think it's very important to know that the foundation of exercise, nutrition, and sleep are more important than anything else, really.
Yeah, they seem foundational.
Yes.
Okay, well, I want to get into some good stuff. The good, the good parts of getting into, this second phase.
The menopause phase.
Just like maybe based on your experience about like yours or some patients, like how as women we kind of step into the power and the maybe joy, dare I say, of this phase of life, because I think just culturally we talk about it in such a negative way, maybe,
connotation.
it always feels so negative, and I feel like a lot of women talk about how much they've never felt more like themselves in this phase, and they really became who they're meant to be in this phase, and they felt so powerful, and they felt almost like I've heard like almost a relief, or that they could finally let go of societal expectations or people pleasing or all these things.
Right.
So maybe talk more about that, because I kind of want to leave everyone with some hope.
Yes.
Because it is a hard time, a hard change for a lot of people.
Yeah, perimenopause is definitely challenging, and some people go through it differently than others, and it's really important never to compare your experience with someone else's. If you're having a harder time in perimenopause, it's not because you're doing something wrong and they're doing something right. And it's really hard to address everything with just exercise and nutrition. So it's really important to give yourself a lot of grace in that difficult time. Menopause, on the other hand, is a bit different. Now, when you don't have hormones on board, that can be very symptomatic. And being able to take hormone therapy can make things much better. So if we're treating the hot flashes and the insomnia or the mood changes, that's great. Really, it's about 4 years after the menopause transition.
Oh my goodness.
There's my patients who are like 60 and they're like, oh my God, this is amazing.
Another 15 years to go. This is going to be a long road.
I know. And it's not always so bumpy. But I will say that, though, that there is this new appreciation for who you are as a person and acceptance and giving less,
F's,
as you would say, because we are, we grow up just caring so much about what people think of us, and hopefully this generation of daughters is not necessarily going to be growing up this way, but there's this huge pressure we put on ourselves. And when you go through menopause, and maybe it's because you've gone through perimenopause, and you're like, whew, I was able to do that. I can do anything now. So maybe part of that is that. But the brain comes back on board. You're not scatterbrained anymore. Your emotions are calm. You just feel a relief and almost a release. It's beautiful to not have periods anymore. By the time that you go through menopause, most women are ready. It is difficult for some women, especially if they're going through it during a younger stage, but it's a stage of life that is now just focused on what is it that I think I could do to better the world and to better myself that feels good to me. So it is very empowering time for women.
It's interesting because when I think about my cycle, there's just like a deep connection. It's been something I've been living with for a really long time. And it took me a long time to see it as this like powerful, beautiful thing, right?
Yeah.
I definitely didn't feel this way when I was 15,
Right.
So I often wonder, is there going to be a grief associated with this time, kind of me moving on from this time in my life, because I actually now really love it. Like, it's like, I love being this cyclical being.
Yes.
And, there's just something so, I don't know. I think I've grown to like attuning to the cyclical nature of being a woman.
Yeah, I think there is grief.
So maybe you can also speak to that, like the grief, but then the grief leading the way to something maybe better.
Yes, I think there's definitely grief that comes with loss of what we've been tied to for so long. And there's sometimes grief with loss of, I'm not able to have babies anymore, if that was part of what you were doing in your life. And so losing that is just a change in a relationship with your body. It's just a dynamic change. And every woman goes through that differently. Women who've had very difficult, painful, heavy periods that negatively impact their lives, they feel pretty much relieved. Yeah. And other women can have some grief around that. Yeah, but it is a transition that we all go through. We're if we make it to menopause, that's something to be grateful for, and then continuing thereon.
Yeah, that means that we got more life, right?
Yes, absolutely.
Yeah. And hopefully, in at least for 20 or 30 years, hopefully, if we live into our 90s, we get like those years where we really feel so confident in who we are.
And calm.
And
grounded.
wise. And, that we've been there, done that, done all these things, and we can really come into our own. And
I 100% believe that. Yeah.
Sophie, is there anything that we haven't covered that you feel like you are really inspired to share with people? Or, is there a book, or is there a resource, or is there a mantra, or is there anything that you feel has helped you on your journey that you think could be helpful or supportive for other women out there listening to this or watching this?
I think there's a lot of information available to people, and sometimes it can be overwhelming. And so I really want people or women to also try and see what resonates with them. That's really important. So we're not playing against each other, but we're here together, and hormones work for some person but may not work for another person, and that's okay. And if you don't do hormone therapy, you're going to be okay. There are other things that you can do to improve some of the symptoms. So there's not just one way. And that's an important aspect of approaching this when you're bombarded with so much information. I would also think that it's important to find a provider that you trust. Somebody that makes you feel like, yes, you heard what I said, and I feel, validated. And even though we may not know what the solution is, we're going to work together towards that solution. And if you feel discounted or
gaslighted,
then find someone else. There are lots of wonderful providers that are here to support you.
Do you have a book or a resource that you love?
So I like the book Estrogen Matters. It's written by Dr. Blooming, and he is an oncologist in California who wrote about treatment of menopausal women who have had breast cancer. So my sister had breast cancer, and I'm very passionate about supporting women who have had cancer when they go through their menopause transition. I thought that was a really good book when I read that a few years ago. The New Menopause by Dr. Haver is also a very good book, and she's really leading this let's be loud and talk to everyone about how we can change the way menopause is viewed. That's another really good resource as well.
Awesome. So as each woman kind of steps into this phase of life and really steps into her power, what can change?
I hope a lot. I hope things can change in our society. I hope women have a bigger voice in their own healthcare and the healthcare of people that they love. I also hope that as a global community, women are more supported in areas where they are not. Yeah.
Thank you, Sophie.
Yeah,
Thank you.
So great. Yeah.
If you enjoyed this conversation, please like, subscribe, and share with a friend. You can connect with Into Healing on TikTok and Instagram for more inspirational and behind-the-scenes content, and visit our website, intohealing.com, for transcripts and other goodies. Thank you for joining us.